But again, they were just searching for answers, and so are we. And so hopefully, with the Magis coming out, and as this case continues to develop with the investigation, we'll get those answers that we want. It's 9:38. Let's keep it in the KUAM News Zoom room here, where we have Hospital Administrator Lillian Posadas standing by. Good morning, Lillian. Happy Easter.
Good morning. Happy Easter, everybody.
I'm digging the hair, Lillian.
I haven't had time to go get a cut.
Oh, come on. You're over here looking like a million.
Looks
Like, oh, this
good.
old thing? What? You even bobbing your head a little bit?
It's growing.
Yeah,
Just like my husband is growing his hair. We're growing it.
right on.
Looks
It's a
good.
new style.
So we brought you on for an update, but when I look at these, COVID numbers with GMH, sometimes
Yeah.
I wonder, is there anything even to update? But there's a lot of stuff going on at GMH other than COVID, right?
Oh, yeah. Time. But yeah, we are very, fortunate, and we're really glad that the numbers are staying low. The last couple of days, it's been zero. Beginning of March, we started out with about 5, and then we just eventually tapered down to zero. And the last 4 days, we've been at zero, which we hope this trend continues. Which speaks well for the community. People are adhering to the wearing of the mask and vaccinations, and so I hope if we continue in this trend of zero hospitalization.
Lillian, now that we covered kind of the COVID, what types of numbers are we seeing with everything else at
In
GMH?
terms of non,
Right, and just
yeah,
admissions in general.
right. We're going back to numbers again, especially individuals who need the heart monitoring level of care, such as telemetry. And so, and we also have individuals who need ICU level of care. And so we're sustaining that. And we moved the pediatrics unit where we had relocated them to the small area of the rehab department. We've placed them back now to their regular, normal home base, which is the 4th floor that we had converted to Care 3. We've cleaned that up, and so now the pediatrics staff and the patients are back to their home base on the 4th floor, original unit where they were pre-COVID.
Okay. Well, you're head of this Guam Medical and Public Health Services Action Plan Task Force. When's the last
Right.
time, or when is the next meeting, and what's on the agenda? How often are you guys going to meet?
We were scheduled to meet tomorrow, but we wanted to meet with the governor first, myself, Mel Mendiola, and Vera, just to really have a more clear direction and, with the governor and an understanding before I meet with the performance-based contract consultant. They're the recognized consultants who manage OEA grant projects. They've been recognized, by the federal government that granted this OEA monies for a feasibility, for a financial assessment impact study to be done. And so I'm going to meet with Mel and with Vera, with the governor this week to, have a more specific task that we want this PBC consultant and meet with them, and then again regroup with the task force.
How much money did you guys get to conduct this feasibility study?
A grant from the Office of Economic Adjustments, that was about $1.76 million that was awarded to the governor. So the governor's office is the awardee. GIDA is a sub awardee. And so those are the key players that I will need to meet with to get really clear and specific, direction, how we're going to proceed with this.
So what is the focus of the feasibility study? It's not to conduct an assessment of the hospital, is it?
Not of the hospital, but of the site and potential sites, and also environmental assessment of it. And so, we can then have a better idea which location. The desired and the preferred location is the central location, which is the Eagles Field. But, again, we still need to make sure an environmental study, a feasibility and financial impact study is conducted before we proceed.
Did the Department of Defense say, okay, that's good to go? You guys can use that property and come on in and do a study?
If the assessment is done, we're still waiting for the official handover from the military. And I know that the governor has been working very closely with Admiral Minoni and working those details.
Are
So
these,
that's the other reason why. Go ahead.
Are these excess lands that we're getting back from the feds?
Probably excess land, or I don't really know if it is excess land, because right now it's not, it's being used for a football field. But it is one of the sites that the military has offered the governor that they will return to the government of Guam.
What other sites, what other areas are you guys looking at?
The other sites that the military offered was the South Finnegaton up north, going towards Nick-Tams. That's one of the sites. And then I believe there was another one. The third one was Nimitz, somewhere in Nimitz area, Nimitz Hill or Nimitz Beach area. I can't remember exactly, but there were 3 sites that the governor mentioned that the military was willing to return to the government of Guam.
And economic impact studies are going to be done of all 3?
Well, all of that is part of that. I'm not sure that they're going to do it on all 3 because of the time constraint. We want to do some groundbreaking by next year. So that's another detail that, when I meet with the governor this week, how we're going to proceed.
Right. So the meeting for tomorrow is postponed.
Meeting for tomorrow is postponed. When we had the meeting with the task force, the initial meeting 2 weeks ago, we had agreed, or I at least said that we would like to meet twice a week, which was supposed to be yesterday, but we're going to hold off until we get more directions from the governor.
Will these be public meetings?
The task force, the core task force may not be, but again, that's something that we will discuss this week. Because we want to keep it small. We don't want to have a really large task force, because then it gets more challenging to try and really accomplish what we need to accomplish, especially given the time that we want to get things done and rolling.
Yeah. Well, Lillian, we're kind of talking about time. We're a little tight on time, but maybe next week we can get you on. And I kind of wanted to go in more about how the location of a new hospital will play into the existing healthcare systems that we have in place, right? And with the proximity and the triangulation and all that. So maybe we'll set it up for next week, and then hopefully you'll have met and you can share more info. Yeah. Appreciate your time, though. Good to see you again.
You look good.
See you here. Stay safe, Guam.
Esta, Lillian. Adios. Yeah, that's definitely interesting. It's just interesting because when the governor first had come out, it was like Eagles Field. And then now we're hearing that there are actually a couple other sites that are being looked at. But I'm just wondering, from an excess lands standpoint, are there original